Good afternoon. There we are. I am in the room. Thank you very much for coming today. I wanted to call this press conference to discuss the COVID-19 virus, also known as coronavirus. I wanted the citizens of Wyoming to be aware of the steps we are taking as a state to prepare for the possibility of a COVID-19 outbreak in the state. These planning efforts have been underway for weeks and will continue as the situation evolves. Joining me today are Office of Homeland Security Director Lynn Budd, State Health Officer Dr. Alexia Harrist, Major General Greg Porter from the Wyoming National Guard, and I think we will be joined fairly shortly by Superintendent of Public Instruction Jillian Balow. I'm getting a head nod, and I note that also the Director of the Department of Health is with us today as well. The first thing I want to emphasize is that there are no reported cases in Wyoming at this time, and the risk to our residents from the disease remains low. While the risk remains low, it is becoming increasingly likely that COVID-19 will eventually spread to the state. The Department of Health and the Wyoming Office of Homeland Security are coordinating state resources and planning efforts to ensure vital resources are protected should events cause a disruption. I have been receiving regular briefings to ensure adequate preparations and that those are taking place to protect our public health. This is one of the most serious responsibilities as a state government. We'll also note that each of our departments is separately also been having briefings, and we have been coordinating between each other. Last month, the President informed a coronavirus task force led by Vice President Mike Pence and comprised of subject matter experts to organize a whole of government response. The administration and Corona Task Force are continuing to work with state, local, and tribal officials, as well as private sector and nonprofit partners in preparing for and responding to the coronavirus. This includes seeking additional funding from Congress to support mitigation efforts. The task force, including Vice President Pence, will convene a weekly teleconference to ensure federal leaders will continue their close coordination with our nation's governors and other state and local officials. In accordance with the Centers for Disease Control recommendation, the Wyoming Department of Health is using its pandemic influenza response plan as a framework for response to the COVID-19 virus. The Department of Health is coordinating with local public health officials. At the same time, the Office of Homeland Security is working with county-level Homeland Security and emergency coordinators. The goal is to provide continuous support to local health officials. As many of you are already aware, COVID-19 is a respiratory disease that appears to be spreading much like the flu. There are simply some things we do not know about COVID-19, such as how easily it spreads and how many patients may experience severe illness. The Department of Health has been providing ongoing guidance and advice to Wyoming healthcare providers, and I know they have been taking calls from healthcare providers seeking testing guidance and have helped them to determine risk and testing criteria. The department has also been conducting assessments of our state hospitals' isolation capacity, bed capacity, and ambulance availability. The Department of Health has also worked with the Department of Workforce Services and the Department of Family Services to provide guidance for employers and has posted CDC guidelines for schools and child care facilities. Additional guidance from the CDC will be forthcoming. They have also been preparing to add the ability to test for COVID-19 in our Wyoming Public Health Laboratory. Superintendent Balow is here. Thank you for coming. And I know that the School Superintendents Association has worked closely with the CDC regarding specific strategies for schools. General Porter is also here and has informed me that soldiers returning from deployment will be going through the COVID-19 screening process as part of the demobilization process. As we conduct welcome home events for our Guard troops over the coming weeks, I want to emphasize that these soldiers have been home for weeks or months, and they are not at risk of spreading illness. Finally, I want to encourage our residents to continue taking proactive steps to help prevent COVID-19 and other respiratory illnesses from spreading. These recommendations include staying home when ill, avoiding others who are ill, regular hand washing for at least 20 seconds, and covering the mouth and nose when coughing and sneezing. And make sure you cover the fingertips as well. For citizens seeking the most up-to-date information, the Wyoming Health Department website, which is health.wyo.gov, again, health.wyo.gov, is updated on a regular basis. In addition, I believe Homeland Security has a website that is also a great source of information. And finally, I understand Superintendent wanted to say a few things, and then we'll open it up for questions. So, thank you, Superintendent.
Okay. Thank you, Governor, very much. I apologize. I was on one more phone call regarding this issue. As of today, I've reached out to school district superintendents as well as our state's associations for school nurses and for custodians. Every community and every school has the appropriate and necessary personnel to lead in the prevention, planning of the coronavirus and other diseases. School nurses, custodians, and principals, in collaboration with county and state health departments, should stay abreast of updates and communicate pertinent information to students, staff, parents, and the public. Schools should revisit their current practices to ensure that they are the very best practices and make adjustments as needed. For example, our desks and other surfaces disinfected according to best practice protocol. Do students have adequate time and facilities to wash their hands before lunch? Should professional development time be devoted to training or retraining staff? Strict adherence to the best practices that our professionals already know are the best measures for prevention. If a school becomes affected by the coronavirus and is required to stop operations for a period of time, I encourage districts to contact my office at the Department of Education, and staff will work with them on the availability of a waiver to ensure that they receive full funding for the school year. It is my responsibility in state law to work directly with local school districts to ensure the health, safety, and welfare of students, teachers, and other employees. I will do what I can to avoid any districts being penalized financially for taking measures to protect their students. Thank you again, Governor.
Thank you. So I guess I would open this up for questions from the audience. Please.
So there are stories coming out of Seattle and Washington State about people struggling to get proper testing for the coronavirus. And I know earlier you mentioned that you're working with the state health department to get that Wyoming lab up and running to test. So what's that timeline looking like, and what's being done to make sure Wyomingites have timely access to coronavirus testing?
Thank you for that. I'm going to let Dr. Harrist.
Thank you, Governor. The Wyoming Public Health Laboratory has the CDC test kits. We are currently working to ensure that the test works correctly and as we expect it to. Once that is completed, we will be able to test in Wyoming, and we expect that to occur within the week.
Talk about this, and could you talk a little bit about what we've seen in past diseases and how this might be comparable, and what you expect to happen?
Well, I think that is a very difficult question to answer. I think right now I could only say that we are not sure exactly what is going to happen with this virus. There are certainly examples of other viruses in the past, other coronaviruses specifically. So there was the original SARS that first appeared in 2003, and we haven't had a case of that in the world since 2004. There is another coronavirus that's called the MERS coronavirus, or Middle East Respiratory Syndrome coronavirus, that emerged on the Arabian Peninsula in 2011. There still continue to be sporadic cases of that virus, but no widespread human-to-human transmission. We also know of pandemic influenza. The last pandemic influenza was in 2009. Most of us experienced that, and that virus, as influenza does, continues to circulate every year during influenza virus season. So I think with this virus, it is very difficult to predict the extent of the transmission that will occur and how long that transmission will occur.
The worst and assume the best, or hope for the best?
Yes, I would agree with that. I would agree that we need to prepare for widespread community transmission in Wyoming and the United States, but that efforts in the U.S. and in Wyoming are underway to try to prevent that as much as possible right now.
Just to follow up on that, Bob, we've been 3 weeks or better really trying to coordinate our efforts, which is one reason General Porter is here, just to make sure that people understand that we have a wide array of resources that we can deploy to address this issue. And I've also been in contact with my neighboring governors to sort of understand regionally how this will be dealt with. So, other questions? Yes, sir. I think part of the issue on that, we have not seen any direct trade. Obviously, the stock market has taken several hits. That has implications more broadly, both to our oil and our natural gas markets. We haven't really been able to draw that direct connection yet, but I anticipate that we will start to see problems coming from that, which is one reason the Department of Workforce Services and Family Services has been asked to sort of prepare a plan for if there are times when people are laid off or other issues like that. We are not anticipating that to happen, but I think it's best to be prepared for the worst. Thank you. Any other questions? Sure. Is there anyone on the phone?
So if you're on the phone and you want to ask a question, you can hit *6 on your phone, and we can take questions from the phone.
No? Please.
There are also reports from other states that have the coronavirus that stores are running out of supplies. And so what's being done in Wyoming to make sure if there is an outbreak here, people have the adequate resources they need?
I have two great experts here. So, Lynn, do you want to say something?
Yeah, just know that we are doing planning for supplies in conjunction with the Department of Health, and also planning for the case if we should have a reduction in force for medical personnel. There's a thing called EMAS, the Emergency Management Assistance Compact, and that is a relationship from governor to governor in the sharing of resources. And we're also looking at how can we in Wyoming share resources with other states.
Okay. Yes.
Thank you. So with this being a new virus, we don't know exactly who may be more likely to get the virus versus others. However, we do know that people who are older and people who have underlying medical conditions are more likely to become severely ill with the virus than other healthier people.
Any other questions?
This is Aliana from the Sheridan Press on the phone.
Yes.
Hi there. Could I get each of the speakers to say their name and title clearly into the microphone?
Sure. So this is Governor Gordon,
I know you, sir.
This is Dr. Alexia Harrist, State Health Officer, Wyoming Department of Health.
Lynn Budd, I'm the Director of the Wyoming Office of Homeland Security.
Thank you.
Jillian Balow, State Superintendent.
And we also have Greg Porter from the Guard, but he hasn't spoken yet, so.
Okay.
Any other questions?
Not for me, thank you.
Okay. Anyone else on the phone? Anyone else in the room? Well, with that, thank you very much. I want to assure people of Wyoming that we are taking steps to make sure we're prepared. There is no immediate cause for alarm. I want to make sure that people understand that and that they can check in regularly with the websites we've mentioned, Department of Health and Homeland Security. And Superintendent, I believe you probably have information available for schools as well. We will be coordinating with county health and also security, county emergency coordinators. So we'll keep you updated as we find out more information. Thank you very much.